Once you've selected your disease group of interest and your population and specified very closely the question that you want to address in your clinical trial, it's time to select an outcome. So you may have an understanding that you're looking to improve something in a disease population, and you may even be as specific as we'd like to see lower blood pressure. But the question is how are you going to measure blood pressure? And it seems very simple from a treatment standpoint. So it's always important to remember that a clinical trial is not the same as clinical practice. So clinical practice, you'll have the patient sit down maybe, and you'll take their vital signs, but you don't know what they were doing right before. And you generally just do it once unless there's a problem or something is really out of ordinary, or it looks like the machine has given you an interesting result. Maybe you'll run it again. But there's nothing really standardized about the way that you've collected that blood pressure measure. So a research blood pressure is a very different thing. There's usually a definition of how long the participant has to be seated at rest. They can't have their legs crossed. The blood pressure is taken 3 times, and the average of the pressure is used on a calibrated and standardized machine that is used only for that trial, if your outcome is blood pressure. So selecting an outcome can be somewhat trickier than people suspect. So in this presentation, we'll learn what are the 2 basic classes of outcomes, and then what are the general considerations when selecting an outcome. And it's always important to remember that design will predict what type of analysis you'll use. So you've heard this before, analysis follows design. So when you're designing your study, when you're choosing an outcome, that's largely going to have a big impact on how you analyze the data. So the general ideas, or the things that you need to ask yourself when you're preparing or choosing an outcome. Start with something that is general, say blood pressure. And then ask yourself, what exactly are you measuring? Is it the systolic blood pressure? Is it both systolic and diastolic? Is it the average daily? So are they going to be wearing some kind of device throughout the day? Is it something that is done in the hospital? So it's pressure done in the veins. Is it a difference score between the systolic and diastolic? Is it an average across a number of visits? So what exactly are you measuring? Does your outcome already exist? We will talk more about this when we look at core outcome sets, but it's really critical to understand the literature in your population of choice. So it's not to say that you can't use an outcome that hasn't been used before, but that generally means that you're trying to validate the outcome, and you'll still need a standard outcome to compare it to. If there's a widely accepted outcome in your population of choice, make sure that you use that in addition to any new outcomes that you'd like to assess, so that you have a way to compare your population to the population at large. And I don't mean all of the population, I mean your disease population at large. Is it objective or subjective? Or is it a combination of objective and subjective measures? So are you combining a clinical outcome that is objective plus a patient-reported outcome about global health? Is it a procedure? So is it something that is happening to the participant? Something like an X-ray or an echocardiogram? Is it a test that they're taking? So is there some kind of cognitive test that they're doing, a standardized auditory test? Is it self-reported? So is it a patient-reported outcome, something like overall pain or level of daily activities? Is it done to the participant, or does the participant have to do something? Those are your basic general concepts of an outcome. Or is it somewhat of a combination of those things? So our 2 basic types of outcomes are hard outcomes, which are clinical outcomes, or soft outcomes, which are subjective outcomes. And there are many examples that fall somewhere in between. So you may think of something as a clinical outcome, but if it involves the opinion of the observer, then it's somewhat of a soft outcome. You may think of something as a soft outcome, but if there is enough evidence, it may be actually less subjective and more on the hard scale. So A completely hard outcome would be considered something like a laboratory test, and a completely soft outcome would be something along the lines of an open text field where the participant tells you something. And then everything from patient-reported outcomes to x-rays that have to be adjudicated falls somewhere in between. So when you're thinking about clinical outcomes, these are medical events that occur as a result of the disease or the treatment. So if your outcome in multiple sclerosis is relapse, that is both a part of the disease, so they occur because of the relapsing remitting multiple sclerosis, but it could also be part of the treatment in that they stop because of the treatment. So if you're waiting for them to be relapse-free for a certain period of time, that's hopefully the treatment intervention. Whereas if you're just following somebody until their first relapse, that is part of the disease process. Clinical and hard outcomes are considered objective measures, so lab tests, lesions on an MRI, though those can get into softer areas depending upon how you define the margins of a lesion. But really the number, the type, the location, same thing for x-rays, an echocardiogram, all of those can have some level of subjectivity but are considered to be a clinical outcome. Time measures can also be a clinical or a hard outcome. So duration of something, completion, how long it takes somebody to complete a 9-hole peg test where they're using their hands to put pegs into little holes in certain formations. Remission. So measuring from the start of the intervention until the length of remission or when you define the start of remission. And any duration time really can be considered a clinical or hard outcome. So what about subjective outcomes? These are measures that are not definitive or are less definitive in nature compared to clinical outcomes. So where an observer exercises judgment while assessing an outcome, so something like the EDSS for multiple sclerosis, there are 15 pages involved in the EDSS examination, but it can be highly subjective. The DAS-28, something for rheumatology, for arthritis, it does have a laboratory measure. It also has a patient-reported outcome measure. And then there's 2 assessments by the treating physician about swollen and tender joints. And so there is some level of subjectivity to whether or not something is classified as a swollen joint. If the outcome is self-reported by the participant, so quality of life, functional status like ambulation, though ambulation can be a hard outcome, how long does it take to walk 25 feet? Pain scales that are reported by the participant. Now, you could make pain a hard outcome by measuring the level of the pain medication in the blood, or you could make it a subjective outcome either by counting pills or by the patient reporting their level of pain. Patient recall or participant diaries are also very subjective. They're only telling you what they want to tell you. And it's not to say that people are being deceptive. It's that particularly depending upon your population, they may not remember. So think about trying to recall what you had for lunch last week. And if you forgot to write it down in your participant diary, it's going to be very hard to accurately recall that. Now, there's a great deal of work being done on subjective outcomes that are very handy with our wearable devices and or our smartphones so that people can actually take photos. There are apps for that, research apps based on taking photos of food to help people remember and to send in and be analyzed for the scale and for how many calories and proteins and so forth and so on. So investigate what options you have when you're looking at a more subjective outcome. Even if the scale is numeric in a subjective outcome, so a Likert scale ranging from strongly disagree to strongly agree, even if it's completed by a trained assessor, so if you're measuring level of reflexes, just because it's a number that goes with the selection doesn't mean that it's a hard outcome, and it doesn't mean that you can analyze it as a continuous measure. So if selecting the number relies on some level of subjectivity, then it is a subjective outcome. So how do you select? It's important to consider the following things when picking your outcome. What is the relationship of the outcome to the intervention? What is the relevance of the outcome you've chosen? And how measurable, or what is the measurability of your outcome? So when considering the relationship to an intervention, ask these questions. Does the outcome measure the way that the intervention works? So you'll hear something about interventions called the mechanism of action. How is it working in the body? And is it impacting what you're measuring? So you wouldn't want to be having an intervention that is, say, designed to reduce blood pressure and then measuring lung volume on a treadmill test. Does the intervention impact the outcome? So is the intervention designed to specifically reduce or change what you're measuring? So it's a back and forth. Does the intervention impact the outcome, and does the outcome measure the way that the intervention is working? Is there a direct relationship between the intervention and the outcome of interest? Sometimes you may not know. Sometimes the mechanism of action of the medication may not be precisely known. So it's something that's acting on the brain, and you know that it seems to be making the disease better, but you're not exactly sure how. So those are some of the discussions that you'll have to have, particularly when medication usage is found off-label. And there are many, many instances of medications being prescribed for one thing, and then it turns out that it helps with something else. And so the mechanism of action might not be quite known in that way yet, but that might be part of why you're running this clinical trial. Are you able to explain the relationship between your intervention and your outcome? So there needs to be some kind of tangible explanation as to why you've chosen this outcome and how this intervention would impact it. Otherwise, you're really doing an observational study more so than a clinical trial. So what about the relevance of this outcome? Is it relevant to the following groups: healthcare providers, patients, disease process, and the community at large with this disorder, or just in general, the community at large? So if you're measuring something that is so obscure that patients in the real world aren't going to care about that, then it's probably not the best outcome. This goes with understanding your outcome, how it acts. It's not necessarily something that the patients would care about. So you need to really maybe then incorporate something that's meaningful to the patient population. If healthcare providers can't easily collect this outcome and it doesn't so change over time, then this may not be the best measure to use. If it's not descriptive of the disease process, so if you're in a long-term chronic disease and you're measuring a short-term outcome, this may not be the best measure if you haven't tied that short-term outcome to long-term progression. And then for the community at large, is it meaningful? Is it something that can be interpreted to the community at large that will ultimately be looking for this intervention in the future? And measurability. The outcome should be able to be measured efficiently and reliably. So efficiently is a little bit in the eye of the beholder, but obviously an 8-hour test for someone is going to be difficult to administer for both the administrator and for the participant. So it needs to be something that can be done in a relatively efficient and reliable or repeatable manner. The outcome should be validated. That means it should be anticipated that you understand how it will act, and it should have been validated in prior studies to be giving you the results that you expect in the way that it's measured correctly. It should be sensitive, and it should be specific, and it should be reproducible. Even with subjective observer outcomes, so even if you have a healthcare provider observing the outcome, if you give the same patient to different trained observers, they should come up with similar results. And if you give similar patients to the same observer, it should be consistent results. So it needs to be validated, sensitive, specific, and reproducible. What we're getting at here is, particularly for a phase 3 large-scale clinical trial, is you can't just make up your outcome. It does have to have some kind of meaningful understanding for the community that you're assessing.